When I was 14, my mom almost died, and I didn't have very many options. It was either stay home and take care of your mom or go to school and let her die. And I chose to take care of her.
Sylvia was really discouraged. She'd been into the office time and time again. Her pain was bad, and her depression was really bad, and she was just kind of maintaining that depression level. She didn't have a lot of family support. She didn't have a lot of financial support.
When I first met Chelsea, it was kind of hard to accept how genuine that she was and how much she really cared. And the fact that she wanted to go out of her way and help me is something I had been missing for a while.
A lot of the times it was just listening to her because she didn't have support. She didn't have people to be there for her. And then after a while, it turned into some motivation and support that if you did try, I have a great community health worker that's willing to sit down with you and see what she can do with you.
She knew what she wanted to do. She had her goals set out for her. She just needed that, extra support, that push there to just help her navigate through the things that she wants to do. So I actually set her up with an agency so she can actually get a little bit of income while taking care of her mom. And just being a resource for her if she needed anything or if she had any questions.
I've done more for myself this past 6 months than I have the past 10 years. I went back to school. I not only finished my GED, but I did the 15-week healthcare class and got lots of skills and certifications from that. Like, Chelsea really goes above and beyond. And I've never had nobody go out of their way for me the way she does. For the first time, I'm proud of myself, which is an even better feeling.
Well, I'm a person in long-term recovery, which for me means that I haven't used alcohol or any other substances in over 11 years. When I first came into recovery, I had not been to a doctor in probably more than 10 years. I was really afraid to go. I had done so many different substances and ingested so many different things. I was afraid of what I was going to find out. And here I am, this mom with all these kids. By the time I came into recovery, I had 4 children. I was terrified to get honest with someone for fear of what they would think or that they would judge me. My health continued to deteriorate, my work performance continued to deteriorate, and my ability to be a mom continued to deteriorate. And I was talking to a friend of mine one day, and they told me about, back then it was called Jane Street, and they said, you should go try them because they will bill based on your income. I went in, they had everything right there, the lab and the pharmacy. They were really, really kind, were very thorough. Working now at the Recovery and Wellness Center, we have partnered with Great Lakes Bay Health Centers to provide recovery coach services, and that really closes that circle of the overall wellness of folks. I sit down and I just meet them where they're at, talk about what they've got going, and letting them know that they're talking with another person who's been on the other side of the desk or on the other end of the phone really helps to ease them into the environment. At the Recovery Center, we also offer support groups. They're open, all recovery support groups. Doesn't matter if you're on medication-assisted treatment, part of a 12-step community. If this is your only pathway, we're open to everyone. Recovery coaches have actually extended the length of time that folks stay in treatment. So people are staying engaged, and they're staying longer because recovery supports was added to the equation. Reminds me what a miracle, my life is. If you would have told me 12 years ago, that I would be sitting here offering hope to anybody, I wouldn't have believed you. I didn't have any hope,
My grandfather did carpentry for a living. I think I just really kind of fell in love with it when I was like 5 or 6 years old, and I knew that I wanted to do this for the rest of my life. I was working on a roof, and I have safety equipment that I put on the roof to hold me up, and the roof jack broke loose from the house, and away I went, about 20-some feet to the ground. I fell and broke my ankle, and they rushed me to the emergency room. I didn't really worry about insurance because I was so healthy, and I didn't get sick, so it wasn't an issue. Now, when I went to the surgeon, I still had to have insurance yet, but he looked at me, he x-rayed and everything, and before he could actually do the surgery, I had insurance, and insurance kicked in and paid for everything. James Street helped me get insurance. They helped me get medication. What I like about James Street is the friendly service, the doctors, even the administrative people at the desk. They help you, and that's what it's all about. If they wasn't there, I don't know, people, they would really have a hard time. They would have nowhere to go for help, for health issues and stuff. And it's just, I wouldn't have had nowhere to go. That's the only reason I'm back on my feet. It's like when you're hungry and you have some food to eat. I guess that's the best way that I can explain it. If I know that if an issue come over my health, I have insurance. It's a peace of mind. It's a peace of mind.